How is a retained placenta in dogs treated?
Hello, and welcome to our comprehensive guide on treating a retained placenta in dogs. Retained placenta occurs when a portion or all of the placenta remains in the uterus after the birth of puppies. This condition can lead to serious health complications if left untreated, but with prompt veterinary attention, prognosis is generally good.
What is a retained placenta?
Retained placenta in dogs is a serious post-birth condition. The placenta is an organ that links the developing puppies to their mother, providing them with nutrients and oxygen. Normally, after each puppy is born, the placenta follows. However, if any part of the placenta remains in the uterus, it can lead to infection and other severe complications. It's essential for pet owners to recognize the signs of a retained placenta, which can include excessive bleeding, foul-smelling discharge, fever, and lethargy, among others.
How is a retained placenta diagnosed?
To determine if your dog has a retained placenta, the vet will usually conduct a physical examination and ask about any symptoms you've noticed. The most definitive way to diagnose a retained placenta is through imaging techniques such as an ultrasound or X-ray, which can visualize any remaining placental tissue.
How is a retained placenta treated?
Treatment for a retained placenta varies depending on the severity of the condition. Often, the vet will first administer oxytocin, a hormone that stimulates uterine contractions and can help expel any remaining placental tissue. If this doesn't work, or if the dog is very ill, surgical intervention may be necessary. In this case, a veterinarian will perform a procedure known as a hysterectomy, removing the uterus and the retained placental tissue. In some cases, antibiotics may be prescribed to prevent or treat any existing infections.
What is the aftercare for a retained placenta?
After treatment, it's crucial to closely monitor your dog's behavior and overall health. Ensure that your pet is eating well, nursing her puppies, if applicable, and appears generally healthy. Any change in behavior, decreased appetite, or signs of illness should prompt a return visit to the vet. Your veterinarian will give you specific instructions for post-treatment care, which may include wound care, medication administration, or additional checkups. Retained placenta in dogs is a serious condition that requires prompt veterinary intervention. With the right treatment, your furry friend can recover and continue to live a healthy life. We hope this guide has been helpful in understanding how a retained placenta in dogs is treated. As always, when it comes to the health of your pet, it's best to consult with a professional. Keep an eye on your dog and don't hesitate to seek veterinary care if you notice anything unusual. Your pet's health and happiness are well worth the effort.